Hello, Muscle Whisperers. This is Elizabeth from Coaching to Wellness. In this tutorial, we'll be addressing 3 common conditions that affect the neck and head, and that is tension headaches, wry neck, and postural imbalances. Each of these conditions can limit mobility and cause significant discomfort, as well as affect overall quality of life. Through manual therapy, we can reduce muscular tension, restore balance, and improve circulation. We'll work step by step through key muscles, techniques, and corrective approaches that you can use with your clients. But before getting started, take a moment to like this video, share this with another bodywork therapist that will indeed gain great knowledge from this tutorial, and subscribe to this channel. So let's continue. Tension headaches are often linked to tightness in the suboccipitals, trapezius, and the sternocleidomastoid, which is your SCM, that big muscle that you see when you rotate your neck from left to right. We begin by warming up the traps and all the muscles along the neck with effleurage strokes. So you can go from the base of the skull down to the shoulders. I like to do a lot of origin and insertion work. So right here, I'm doing circular massage just along C3 to C8, just to release the scalene muscle. So that's the origin of the scalene muscles. From here, I move to the SCM muscles, where I use a pinch grip technique to release the SCM. So the SCM should be relaxed, not actively contracting. This muscle can be worked on in several ways by turning the client's head slightly to the opposite side, and this makes the SCM stand out. It runs obliquely from just under the ear, so at the mastoid process, down to the sternum and the clavicle, or with the head flat on the table and your right hand at the base of the neck. Use the left hand to pinch using your thumb on one side and your fingers on the other side of this muscle, where you're gently gripping or grasping the muscle belly between your fingertips. Lift it slightly away from the underlying structures, avoiding pressing into the carotid artery, just medial to this muscle. Apply slow, sustained pressure or a gentle kneading, moving along the length of this muscle. Use the side of your index or pointy finger not to nail the muscle, but to use the side of the finger to make direct contact with the muscle belly. Applying a rhythmic pulse pressure across the muscle fibers perpendicular to the muscle. Apply gentle compression and small cross fiber techniques to the suboccipital region at the base of the skull. These muscles often become hypertonic from prolonged computer work, poor posture, or stress. Sustained pressure here helps to relieve referred pain into the head. From there, we can move on to the sternocleidomastoid and gently cradle the client's head and apply stripping techniques along the length of the SCM, being very careful to avoid the vascular structures. This will reduce referred pain into the forehead and eyes. Finally, what you can also do is some myofascial techniques along the scalp line, encouraging relaxation and reducing any headaches or intensity that's going on within that area. If you're focusing on the neck for wry neck or torticollis, this is characterized by involuntary contraction of one side of the neck, pulling the head into a rotation or lateral flexion. So our aim would then be to release the hypertonic side, which is the tight side, the shortened side, while supporting mobility on the opposite side. Apply deep pressure and stripping techniques along the levator scapula, from the upper cervical spine down to the medial border of the scapula. You can address the scalenes with careful pin and strap techniques, circular friction just at the insertion point of the scalenes. And I do that on both sides. The combination restores balance between the two sides of the neck, so you do both sides, and finish by gently mobilizing the cervical vertebrae through controlled passive movements, always within the client's comfort range. So I also do a little bit of a stretch and rotation in the neck, and using the ball of my fingers right into the suboccipitals to loosen those muscles. Here I speed up the video quite a bit, but I am loosening pec major. I just use my fingers to go with the fiber of pec major, which normally when it gets tight, it pulls along or pulls at the clavicle, which then causes that rounding of the shoulder and those postural imbalances. I go back to the SCM, loosening that muscle there using that pinch and grip technique that I spoke about before, the circular massage along the scalene. So I kind of double back at some of the muscles that I've worked on before, and I go into the face, the head, just loosening the masseter. So once that masseter gets tight, you tend to get some tension headaches. So I work with the fiber of the masseter, and then I go along around the ears, so that temporal muscle. I use my thumb and index finger to gently grasp the edge or outer edge of the ear, and I use my index finger behind the ear while the thumb rests at the front. I apply a slow but steady pull or a little jostle at the air. This is almost like you are drawing around the air and away from the head, just holding for a few seconds, and then you release it. With light pressure, move from the air and do small circles forward and backward around the ears. Use a rhythmic, subtle rocking or pumping motion to encourage the mobility and the fascia around the ear and temporal bone. I then do what I want to call a crisscross hand stretch. So cross your hand over the other so that the palms are cupping the opposite side of the client's head. So your right hand is supporting the left side and your left hand is supporting the right side. Apply a slow, even stretch by gently guiding the head away from the shoulders as if you're lengthening the cervical spine. Keep the motion controlled and soft, no pulling or sudden movements. Now I'm going to do a quick recap on the techniques that I used throughout this video. One, which was working on the suboccipitals with the ball of my fingers and doing circular massage at the suboccipitals. And then I cradle the head and rock the head with my fingers. And then I also allow the client to do a passive rocking as I move through those muscles. I use my pointy finger to do circular friction or circular massage just at the origin of the scalenes. And then I use my pointy finger again to throw through the SCM and pinch and grip technique. I use a circular massage just at the insertion for the SCM as well. And then cross fiber friction at the clavicle to release the pec major. Thank you for joining me in this tutorial. Please remember to like, subscribe, and share. And I will see you in the next video.